today also the practice is there that many of the Ayurveda practitioners, they hide the actual list of ingredients. They'll just give a mixture of powders, and they'll ask the patient to take it without revealing what the ingredients are there in it, or what is the composition of the churna that is being prescribed to the patient. I mean, one thing might be that it could be proprietary, or it could be kind of a generational knowledge of these specific special Ayurveda medicines that Ayurveda practitioner is getting, that he wants to maintain the secrecy. This period is called as like information age. We need to be transparent, and patient has the right to know what the ingredients are there in the mixture, or any medicine that is given. I strongly believe that it is the right of the patient to know the nature of medicine, sir.
Definitely, patient has the right to know what is being prescribed to him. He should be knowing about all these things, and even their side effects, a possible outcome of the therapy, everything should be known to the patient. And before, sometimes even some drastic drugs which are very sharp in nature, that they are being used as a upavisha dravyas in Ayurveda, similarly the chemotherapy drugs in modern. So such type of things, always they'll go for a consent. Patient will be explained the things, these are the drugs we are going to give, and this is going to be the effect, and this is going to be the side effects, probable side effects. Then you may have to go for all these things, and if you're ready for this, you sign the document, and then we start the treatment. So this is the better way of handling the things, and that is the way it is done. So the knowing information about the drug doesn't make anybody authorized person to prescribe or just take the medicine. So if we are qualified in that, then only we should go for it. Point number two is, those who practice mixing of their own combinations and hiding the actual drugs present in that and just giving the patient, probably what I feel is, this is where they try to keep the patients to themselves. So they don't want the patient to be moving, because typically the patients have a tendency that they will be consulting a doctor, taking a medicine for a time being, and suddenly somebody in the family, somebody in the close circle, somebody says that that particular doctor is very good in treating these type of conditions. I have sent that fellow and he has taken treatment from there. Suddenly he switches from this patient to this doctor to another doctor. Then it goes on. Then second thing, once a patient gets some benefit, then he tries to say that, doctor, I am in somewhere in US, I am somewhere in Bangalore, somewhere down there, I can't come to you. Can I take the medicines here? Then the patient may, if you are given a prescribed drug which can be available everywhere, then patient may take it from anywhere, and patient may not come back to him for that purpose. So in order to keep all these things as a part of their generation of economy and all those things, probably that is one of the important reason they try to keep the patient with them. For that purpose, they'll make these type of combinations. I have seen in some Kerala practices where 2 to 3 asabaris are clubbed together and poured together and made into a bottle and given. And once the bottle is empty, then if you want the next dose, you have to consult once again doctor. So in order to keep the patient with them, they are doing all those things. I don't recommend these type of practices. If you are good enough and if your prescription has little real power, then the patient will definitely come back to you. You should have that giving a result. That should be there. So no, it's not a question of combinations. Second thing, when you are giving some powder or something like that, without labeling it or without labeling the content in that, and it is in the open box format or something like that, or some without any seal, then you should be ready to face a bad name, where the people from the other field or something, they'll say that they have used steroids in that, combined steroids into that, and this type of the allegations will definitely do come. So in order to overcome that and make it a practice that whatever you give it in the form of a sealed one container, it is a factory sealed or something like that, it is always good. Otherwise, you label it whatever it is there in that, in the ingredients. That is always a better and a fair practice in any system of medicine.